Welcome to this global webinar, hosted by WHO and UNICEF, sharing new insights from the WASH and Healthcare Facilities Country Progress Tracker, now covering 107 countries. The tracker, of course, monitors the 8 practical steps for national action on WASH in healthcare facilities. These are the steps identified by WHO and UNICEF in 2019, and they're designed to guide countries in achieving universal access to quality WASH services in healthcare settings. We have a very exciting program, a short one today for you, 30 minutes, in which we're going to have the latest WASH and healthcare facilities global updates, as well as key findings from this process to update the Global Country Progress Tracker. That's going to be given by Maggie Montgomery of WHO. And then we're going to have a live demonstration of the tracker led by Lindsay Denny Naughton, who is with the UNICEF headquarters in New York. She's a WASH specialist there. Following that, we're going to have a session which is focusing on reflections and also where we will be welcoming your questions and answers. You will be able to put your questions or comments in the chat box, or you can also raise your hand and we'll turn the microphone over to you to be able to ask a question or leave a comment. We'll also, as part of that session, have reflections from 3 distinguished guests. Waltaji Kutane, who's with WHO in Ethiopia. Sorry for the slide, it's not quite right there. He's with WHO in Ethiopia. And then we have Shofiqul Alam, who's with UNICEF Bangladesh. We'll have John Brogan from Helvetas, one of our international NGO partners. And again, the others will be you and yourselves, raising your voice to offer some commentary or questions. And then finally, we'll have a conclusion from Lindsay Denny at UNICEF, wrapping up today's 30-minute webinar. So again, sorry for the clumsy introduction. Glad that you're able to join us. And now I would like to turn it over to our colleague, Maggie Montgomery, who of course is the technical officer in charge of WASH and healthcare facilities and in other settings at the World Health Organization. Maggie, over to you.
Super, thanks Dave, and good morning, good afternoon everyone. I just want to give you a little bit of a sneak preview on the Global Progress Report, which features the new findings on the country tracker. Just a few points to highlight, and I wanted to know you're hearing this first because the launch is not until September. All countries are making efforts to advance the practical steps. And the practical steps you can see in that top right corner are the national actions that need to happen to support safe and sustainable scale up of WASH services. So that's quite encouraging. Even in least developed countries where we know there's a lot of resource constraints, 82% have fully implemented at least one national action. So for example, they've completed the baseline, they've published the results, they're using those results to influence policy and target resources. 17%, so almost 1 in 5, have substantially advanced or fully completed the national actions. And you'll see there in the graph that we have a 4-point scale. So red, number 1, means no efforts have taken place. 2 or 3 is that there's been some effort to perhaps update standards, but they haven't been validated, to perhaps, draft a country roadmap, but it's not finalized. And then 4 is green, means that the effort is complete. So the standards, not only are they validated and now part of law, they're integrated into, for example, monitoring or some type of regulation. The areas where we've seen there's been the most implementation is on baseline assessments, which is great because obviously you need to know what your starting point is to understand what needs to happen, but also on standards. And that's super exciting. And both for WASH, there's 42%, and for waste, up to 58%. Countries have updated these standards. In many cases, they've integrated elements of sustainability and climate resilience, for example, having water storage. For waste, really trying to prioritize waste reduction and waste recycling. The least implemented has to do with development of costed and financed roadmaps. That's only 14%. When we look at infrastructure improvements, we see that there's a lot of momentum to work in a few districts or to pilot approaches, especially using the WASH-Fit tool, but only 18% has really thought about what this looks like at a national scale, and I've started to institutionalize those improvements within the existing health systems, monitoring, programming, financing. And then lastly, health workforce, really supporting not only the nurses and doctors that need to make sure they clean their hands and have good hygiene, but also the cleaners, the waste workers, making sure that they're trained and properly equipped and have a professional development plan that they can follow. Next slide. I'm not going to go over all of these targets, but these are targets that were included in the Global Framework for Action from 2024 to 2030, which WHO and UNICEF published last year, and many of you probably contributed to. You can see the baseline is 2020. We're at 2025. We have 2028 targets, and obviously 2030 aligns with the end of the SDG period. Again, this aligns with what I was just saying around baselines. We see 90% of countries have met that, so that's super encouraging. It's in green. But if we look at things around monitoring, and this means regular monitoring within the health systems, it's only 21%, and sufficient financing. And this data comes from our colleagues who are working on GLASS, the Global Analysis of Sanitation and Drinking Water. It's only 17%. I did list the service levels there, and if you haven't seen that data, it already is out. JMP, the Joint Monitoring Program, published that data last year. Again, there's still big gaps in all the areas that we need to address. Next slide. So what are the recommendations, and what do we need to really be focusing on? First is around this institutionalize and integrate WASH and electricity. And I want to highlight that we are looking at this as an infrastructure package within all health planning, programming, and monitoring. Until we do that, this will be seen as a side issue and it won't achieve the scale or sustainability. We also know we have to unlock domestic financing. Everybody's well aware of the huge drop in aid for global health. It's up to 40% by the end of this year. So we need to see how we can make better use of the financing that exists in country, and how we better monitor and make sure that whatever is budgeted for WASH and waste actually goes towards those services. At the same time, we know we still need external investments, especially for countries that are in fragile settings or the least developed countries. But those investments need to be in places where there already are steps taken and there's strong leadership. And that's where the country tracker becomes really important. Obviously, aligning and consolidating with climate resilience, electrification, and waste. We should not be doing separate or parallel efforts, but how do we bring these together? And lastly, to address inequities. And we see that there's inequities between, for example, hospitals and primary care facilities, with primary care facilities in most countries having worse and sometimes much worse services, but also looking at equities around gender and around access to toilets and menstrual hygiene, and as well as safety and privacy for women. Next slide. So just want to highlight some key upcoming opportunities. So this report will be launched at a high-level meeting that's being planned at the UN General Assembly, the 24th of September. That's going to be hosted by Hungary, who co-leads with Philippines, a group of friends. This will be a really important moment to amplify the messaging about what needs to happen, to engage across a wide range of sectors, given that a lot of this work is going to have to happen outside the health sector, even though they are the leads. We also have the Global Strategic Network, which is a group of 40 partners with high level and technical folks who are trying to address some of these strategic questions, and they'll be able to kind of grapple with how we actually implement some of these recommendations in a formal meeting in November, as well as some drop-in calls before that. WashFit is ongoing, and we're always super excited to hear about what's happening on the field. Those courses are online, and encourage you, if you haven't taken them or shared them, to do so on the WHO Academy site. We also will be planning a WashFit drop-in to talk about some of the practical issues around implementation. And then lastly, there's a number of upcoming events where we can streamline this messaging. One in particular that isn't on here is also the UNC Water and Health Conference, where there looks to be several days of discussions around WASH and healthcare facilities. Next slide. So I just want to highlight the timeline. You know, things really ramped up in 2019 with the World Health Assembly resolution. Then in December 2023, we had the UNGA resolution on this issue, which broadened it to include electricity, a much greater focus on sustainability. And we have the launch of the Global Report, an UNGA event happening in September. So for all of you who are already highly engaged, I want to thank you. And for those of you who would like to get more engaged, I encourage you to do so. So I'll hand it back to Dave. Thanks.
Thanks very much, Maggie, for that really exciting update and a lot going on. And we'll, of course, share these slides with all of our colleagues on the call so that they can look at this at their own convenience. And as well, during the next session, I'll put in the chat the link to the Washington Healthcare Facilities global newsletter, because if you're not receiving the newsletter, then you might miss on some of the updates on all of this over the next couple of months. So I'll put that on in the chat in a moment. But for now, we're very happy to have Lindsay Denny Naughton, who, as I mentioned earlier, is the WASH specialist at UNICEF, based in New York. She's going to show us in live situation how to use the updated country progress tracker. She'll give you highlights of examples and new features, and she'll talk about the different kinds of topics that it covers, whether they are thematic, such as health systems monitoring, climate, or equity, or any of the 8 steps. So I'm going to stop the share now, and I'm going to turn it over to Lindsay so that she can share in live. Lindsay, I think you have it, don't you?
I do. Great. Thank you so much.
Okay.
Great to see you all here. Thanks for joining this morning, this afternoon, this evening, wherever you are. So many of you are familiar with WashingtonHCF.org, but this is our primary website for all things Washington healthcare facilities, and a great place to stay up to date. So I'm just going to show a couple of pieces on here. So first, when you go to the top, you'll see an option for country tracker. Underneath that is the practical steps. So I just want to highlight that we do have a definition and information about each of the practical steps on the website, as well as related links to learn more, including the original document that describes the practical steps from 2019. But then if you go under the country tracker, you will find the full updated as of like a month ago, 2025 data from the 8 practical steps. And now this is the most robust we've had at this stage. We have 107 countries. We had 101 countries submit data this round, and data was collected between October and about January for all of these countries. Data was then validated with the ministries of health and water, as well as country colleagues from WHO and UNICEF and other partners. So this has been validated from country governments. And as you'll go down, you can see information on the situation analysis and baseline assessment, step 1, national coordination and national roadmaps and targets, that's step 2. The difference here is that we split these steps apart this time. This used to be one singular this singular score, but now we've separated that out in particular so we can get more granular information on what countries are completing costed roadmaps with targets. Then we have step 3, which is standards on Washington healthcare facilities and healthcare waste management. Step 4 is having an infrastructure improvement program, which might be WASH Fit, it might be something specific to the country. Step 5 is national monitoring, so having indicators in their national monitoring system like HMIS, and the step 6 is workforce development. And so you can scroll through and see all 107 countries. So as I mentioned, 101 countries were captured this year. That means there are 6 countries whose data is from the previous data collection process. We don't note which countries come from which time point, but all this to say it's the most recent data on these countries. And so as you can see, we've got this scoring, as Maggie had mentioned. The score is a score of, which I don't actually think we have on here, I will update that, but a score of 1, meaning that no action has happened. A score 2, meaning that there's plans in place, that they've started to talk about doing this work. Step 3 means implementation is underway. So you might be working on a costed roadmap. It's not yet published, it's not yet validated. And then step 4 means that it's fully implemented and it's up to date. So again, you can go through, we've got data for all 107 countries. When you see this little icon here, this tells us that there is a resource associated. So we've done this for steps 3 and steps 4. So when there's efforts that can be published, you can go ahead and open that up. And you will get the related resource. And so in this case, these are the national guidelines for Washington healthcare facilities in Cambodia. What you can also do, and I see we have a colleague from Ministry of Health in Ethiopia, so I'll use you all as an example. You can actually go to the country itself, and if you click on that, you will get all of the resources linked to that country. So while we have resources related to the 8 steps that are specifically linked to the tracker, there are many, many other resources. I think there's over 600 at this point in our resource repository. And so you can go ahead and see all the resources from that country that's been tagged, Ethiopia, Cambodia, etc. So a good way to kind of narrow down your search. So I think that is all for now, but I just want to say this is the most up-to-date. It's a super useful resource. I highly encourage you to check it out. We will continue to keep these updated. We have done minor updates between the big years. So for example, if Ghana were to finalize their country roadmap, I could go in and update this. So it is alive. It stays as updated as possible throughout the year. So I'll stop sharing there and back to you.
Thank you so much for that update, Lindsay. Very exciting to see all of the new information which has been added. And we encourage all of our colleagues on the call to join, visit the site, and of course work with it and see what it offers, especially on their own country, and share it with others. But now we're happy to move on to our next section of the program, where we're going to have a short discussion and a Q&A period. We're going to begin by having 3 short interventions from colleagues who you see on the screen there: Waltaji Kutane from WHO in Ethiopia, Shofiqul Alam from UNICEF Bangladesh, and John Brogan from Helvetas. So the procedure will be that I'll ask each of them a question, we'll have a short response, and then we'll open it up to everybody on the call. And so if you have a question or a comment, please do leave it in the chat or raise your hand, your electronic hand, and we will get to you. So first, we're going to begin with Waltaji Kutane. Waltaji is the climate change specialist in health, water, sanitation, hygiene, and air quality at WHO Ethiopia. He has over 25 years of expertise in the area of public health and healthy environmental linkages, particularly around, of course, WASH, climate change, and health, as I mentioned. So Waltaji, if I could ask you to turn on your camera so we can see you here on the screen. Let me see.
They've already turned to my camera. Thank you.
That's wonderful. I'm going to add you as a spotlight here. And Waltaji, because we're very interested in what's happening at the country level. We know you've been very active in Ethiopia. So can you tell us, how has the tracking of the 8 practical steps been valuable for Ethiopia, and what are you doing to advance the steps? And if you have commentary on any particular steps, feel free to offer that as well. Over to you for a short response.
Thank you very much, Dave. Good afternoon, good morning, and good evening, colleagues. I'm happy just to do some intervention in a very few minutes. The Ethiopian WASH healthcare facilities back to 2014, where the Ethiopian government recognized the challenge in healthcare facility when it comes to WASH, healthcare waste management, and electricity, the energy in 2014. So the first baseline assessment was done at a different level of from the tertiary to the primary level, and we started implementing clean and safe healthcare service delivery related to the WASH service in healthcare facility. We have presented in many forums in 2015-14 this issue. When the WASH feed came up with the WHO and the UNICEF, we adopted the WASH feed to the existing initiatives in Ethiopia. So the government recognized this problem, and then these practical steps helped us what we are doing to do in a systematic way. So the WASH feed, especially the WASH feed, helped us a lot in capacity building and the development of the roadmap, doing the costing roadmap we have used when we did recently the WASH and healthcare facility roadmap. We have used the costing system which has been developed jointly by UNICEF and the WHO. And then we are looking this tracker as a tool, as a monitoring tool for us to move forward. If you look at all steps is green for Ethiopia this time. We have finished already the costed roadmap, and it's being implemented. And so I think for us, it is a guiding tools and helping us to progress, to look at what we are doing, and then also the technical working group, which is a think tank for the Washington Healthcare Facility, is well acquainted of the tools and also the wash fit. So we used the team, the technical working group, helped the ministry to use these tools, including, because in this technical working group, we have the universities and also professional association, the environmental health association, the public health association, all these health associations, particularly the public health association, covers from doctors to the medical people. So this the engagement of this association also is one of the tools. So the steps helped also to different initiatives apart from the wash fit. Recently, there is a SEDU Ethiopia, which we call it a Clean Ethiopia 2025 to 2030, as throughout the country. Washington healthcare facilities and electrification is one of the top priority in these Prime Minister initiatives. And then for the healthcare facility, this initiative, the new initiative, is led by the minister, Her Excellency, the Minister herself. So those are the tools and the partnership. Finally, I want to highlight the partnership. The partnership is in Ethiopia is not a meeting. It's not only a meeting. Partnership is investing in the software in capacity building from national down to the healthcare facility, and also infrastructure, putting the waste dome, the incinerators, all the water supply. The partners also invest in that at regional and healthcare facility in supporting the improvement of the wash in healthcare facility. So Ethiopia benefited from that through the partnership and the collaboration. Finally, the One Wash program, which is all very prominent throughout the world. In Ethiopia, it has an institutional wash component where wash and healthcare facility is one of the area. It's supported by fund from the consolidated One Wash account, which is governed by the partners, also the government putting in one account. There is a component on the wash and healthcare facilities. So that is also one of the area helped us one planning and one implementation and the monitoring. So I can say this we are moving. Even before on Monday we had a big meeting to organize in the country in September a big advocacy workshop, which is going to be led by the minister herself, bringing all partners for the advocacy on financing on washing healthcare facility. We are in preparation for that at the country level. Thank you, and over.
Okay. Thanks so much, Waltaji. Gosh, I think all of us would like to comment so much on the robustness that you've described in Ethiopia, everything from the capacity building to building on what the work had been done before, layering on the steps, also, of course, linking to the costing tool that's been developed. So I've spoken a bit, but let's now turn it over to our next colleague, Shofiqul Alam, who's with UNICEF in Bangladesh. And actually, Shofiqul, we're going to ask you the same question, and this might give us a good opportunity to compare and contrast the Ethiopian and Bangladeshi experience. So, Shofiqul, if we could ask you to turn on your camera, if you like. I see you're able to talk. Same question to you. How has tracking of the 8 practical steps been valuable in Bangladesh? And what are you doing to advance the steps? Over to you, Shofiqul.
You can hear me?
Now we hear you. Yep.
Okay. And camera, I don't see the icon to on and off the video camera. It's on your hand or it's on my screen?
I guess I don't. Oh, I have. Let me hold on. Now we do it. Okay. I promoted you to panelist, so now it should work. One moment. If you go ahead and begin, I'll get the camera going as soon as possible. Okay. Okay, now we have Shofiqul on the camera as well, I believe. Over to you, Shofiqul. Can you hear us?
Yeah, I can.
There we
I
go.
can hear you. Yeah.
Welcome.
Very good. Okay. Thank you. Okay. I think unlike other countries, firstly, I would say that this HCF Tracker, 8 Practical Steps, is led by WHO in our country. But we work hands on hands, WHO and UNICEF. And the reporting responsibility is basically on WHO to contact directly with the government counterpart. But last time when we submitted, we worked very much closely, WHO and UNICEF, and we submitted actually the updated report jointly to our government counterpart to submit it to the Secretariat. Okay, that's how we administer the 8 practical steps. Now, let me to say in Bangladesh situation, actually, WASH in healthcare facilities, the situation was not as good as today. If I talk about 7, 8 or a decade back, WASH was not a priority actually to the healthcare facilities. But in the recent years, a lot has done. Improvement has also done a lot. If you see the score in the tracker, that has gone up. And I think we are working together hard to take it further ahead. Like, a few things like WASH fit buy-in by the government. So we have already conducted WASH fit in 32 hospitals, a full-blown WASH fit. We have got a 3 days WASH fit training in our country with the policymakers, the high-level officers. And we are planning to do more WASH fit to cover our subnational health colleagues as well. And government, say 3-4 years back, WASH fit was a unknown word to the Ministry of Health colleagues. So now there is an expert group in the healthcare Ministry of Health, DGHS, particularly Director General of Health Services. We have basically 2 directorates under Health, Director General of Health Services and Director General of Family Planning. And we have already established a WASH cell inside DGHS. So that's a hub where the WASH activities are coordinated among the national, subnational, from primary to tertiary level of hospital. This is one. Then this is the first time we are having a national baseline survey in hospitals. The data has already collected and the report preparation is going on. By end of September, the final report will come up and we will do a dissemination of the baseline situation of WASH in healthcare facilities. We have started working on the revision of WASH in healthcare strategy. We had one, but it got expired in 2023. Now a rigorous consultation have done with the Directorate of Health, Director General of Health Services, along with the other relevant stakeholders. Department of Public Health Engineering, who deals the drinking water, sanitation and hygiene, Directorate of Environment, who regulates the waste management and other things, and the city corporations who manage the waste in the city level. So with the consultation or accumulation, all these departments, we are almost in the final stage of preparing our strategy, WASH in healthcare facilities, and the strategy that will also be finalized definitely by end of this year, I should say. Now, a few indicators, if I talk about here, Lindsay has already shown us the indicators in the trackers. Situation analysis is 3 and baseline survey is 4, but I have not had consultation with WHO before I come here, unfortunately, but maybe we will discuss that if the situation analysis score can even go up, because we are having our nationwide situation analysis survey or baseline survey, whatever you say. So it is done, and the report is coming by 2 months from now. So that should go off actually. National coordination, I should also say that we have already set up 3 different kind of technical group we have our steering committee for washing healthcare facilities, we have our technical group for washing healthcare facilities, we have our wash cell in the DGHS. So in the different layer, and also we have a 30 comprised of 30 members from different agencies, the National Technical Working Group. So I claim that the coordination has improved a lot in our country. If you talk about, say, again 3-4 years back, there was no coordination. We have particularly Ministry of Local Government, Rural Development, and Ministry of Health, or even Directorate of Environment, Ministry of Environment, Forest. These ministries need very close collaboration to work, because the waste management is under local government division, the health is definitely with the Ministry of Health, DOE is on the regulation side. So now we have brought up all these relevant ministries and directorates in a platform, and we are meeting on a regular basis to talk about the wash situation in the healthcare facilities. So I was thinking that maybe in the coordination level also we have gone up. We are doing a lot. Our effort is there. So in the other areas also.
Shofiqul?
Yeah.
I'm so sorry. We're going to need to probably cut you off just because we're going a little bit long. But I do want to say thank you for your intervention, because I think what you've pointed out is that you've made actually very vast and fast progress in Bangladesh, as you said, in just the last 2 or 3 years. So what we'll do is we'll share your contact information with all of the colleagues on the call tonight, and they can be in touch for further updates from you in Bangladesh. But thank you so much for your intervention. Really appreciate it. Thank you so much.
Thank you so much.
And now we go. Thank you. And now, friends, we go to our final panelist, and this is going to be John Brogan from Helvetas, which, of course, is a very well-known international Swiss-based NGO, and, of course, partners in countries for advancing washing healthcare facilities. Very much involves international NGOs or local community-based NGOs. So, John, I think we have you on the call. If you could turn your video on, we'd like to ask you a similar question. Basically, how is Helvetas using the information in the country tracker, and what are you doing to advance the steps, looking at it from an organizational perspective? Over to you, John.
David, and thanks for having me on. I'm trying with the video. It's coming and going, so I'm just going to go for it because I know we're behind time. So for Helvetas, and we're part of a consortium, there's other members of the Swiss Water and Sanitation Consortium working on wash and healthcare facilities. These 8 practical steps, and particularly the tracker, it really helps us to gauge the situation in a country, to understand where the health system is at regarding WASH and IPC. It's especially true if we're new to a context. We're just arriving and we want to inform ourselves. But it's also relevant when we're very much a part of the process, and we've been a part of the process for several years. If we're part of a national community of practice, for example, these 8 practical steps, they really help us to align with and to work alongside our partners, our actors. For example, in Mozambique, where Helvetas has been supporting the region of Cabo Delgado to roll out wash fits in 50 healthcare facilities, it's a joint effort. But when we joined the national community of practice, and when we understood where they were with the different tracker aspects, we could see how important it was to start a learning journey and to be able to share back that experience to the national level. So the country tracker is really helping us to gauge, how strong is the national effort for wash and healthcare facilities, and maybe how that is also finding expression locally where we already work, or where we're intending to start working. At the subnational level, if we know where the country is heading, we can work with the actors at the subnational level to also take those steps. Something that, we're really into using WashFit, like so many of the other partners, similar to WashFit, which has found, a home in over 70 countries. This wide participation of working on and tracking the 8 practical steps is super useful for us. It really gets us on the same page with the concerned actors. And knowing the story about what's happening in a given country, it creates a shared understanding of where we come from and the vision. And that's really important to galvanize action. Because in the end, as civil society actors, we are temporary co-facilitators at best, right? With the support of our donors, we're working on investment readiness, domestic, multilateral, but we need to have a sense for where we need to focus our efforts. And, whether it's capacity building efforts or advocacy efforts, that's really key, and the tracker helps us. And congratulations to Waltaji and Ethiopia for having this national advocacy workshop. That's great news. If I just wrap up to say that the tracker itself, it's a great starting point to jump to action, or to know where we need to conduct further analysis with the actors to see how we can support the national vision and where that's heading. Thanks a lot, David. Thanks, colleagues.
That's really wonderful, John. We appreciate your perspective from that of an organization, Helvetas. And as you mentioned, there's flexibility, right? This tracker can help you know maybe where you ought to begin or where you ought to add a little bit of focus. So we really do appreciate that, colleagues. Please do be in touch with John if you like. We had promised a 30-minute webinar, and we're 5 minutes over. So we do see a couple of questions in the chat box, but we're going to respond to them offline through a short Q&A sheet, because we know everybody's got a lot to do and they're very busy. So we're going to turn it over to Lindsay to give us a minute or so of closing final thoughts. Lindsay, over to you.
Wonderful. Thank you all for joining on this quick little dive into the country tracker data. We will hold a full-on webinar when we launch the report. We will talk more about the data. We will also have this in multiple languages. I've seen requests for French both online today and in previous sessions. We'll have it in multiple languages, and we'll get more into the fun of what does it mean. But we wanted to give you that snapshot today before it comes, because the tracker is live. So please go and use this information. Share more resources if you have them. I've dropped my email in the chat, but feel free to reach out. But then we look forward to connecting you with all. It will likely be in October. The report is going to be launched in late September in line with UNGA. But look forward to that. And we'll also have some upcoming events, as Maggie noted, opportunities for the community of practice to come together. So please sign up for the newsletter if you haven't already. That's the best way to stay engaged. And we look forward to seeing you all the next time. Thanks so much.
Thank you so much, Lindsay, and thanks to all of our colleagues and friends for joining us on the call. Huge thanks to our participants, Waltaji, Shofiqul, and John, and of course you, Lindsay, and Maggie, and especially a big thanks to all of you who joined us for today's webinar. We'll continue the conversation, and please do look forward to those reports and activities taking place in September and October of this year. Have a good day, a good afternoon, or a good morning, wherever you are in the world. Thanks very much for joining us.